hear me okay? All right. Well, it's really such an honor to be here at this conference and to meet many of you, to be with community members and peers that are so passionate about these connections of food, farms, and health. It's really fabulous. We have an opportunity to be together in settings like this, and then over the next couple days in smaller groups to really learn from each other. Community of conversation, I heard, but also I know this to be a community of action. And it's really fabulous to see when conversations move into action. And I'm especially honored to be here, being able to interact with those in the healthcare system, because we know that making these connections between food and farming and healthcare is so important. I want to start this evening, much as my colleague Dr. Rivard did, talking about what inspired me to really get into this work that we do now and that I'll be describing at Fair Food Network. So I want to, there we go. So what I want to do is I want to take you back to when I was 36 years old. So Roger, you recognize Lucinda there, a little younger too, right? So when I was 36, I found myself in the hospital. I had been diagnosed with Crohn's disease when I was 25, and by the time I was 36, I had such a severe flare-up that nothing was cooling it down. So I'm in the hospital now. This is down in Lansing, and I'm being pumped full of prednisone through the IV, and the doctor comes in. I mean, I could not absorb water. I was completely dehydrated. My digestive system had really just broken down. And the doctor comes in and he says, we need to see if this inflammation will cool down. If it doesn't in a couple days, our only option is surgery. Got to go remove your colon. So I'm lying there. A couple days later, the doc comes and he says, well, now we need to see how you respond to eating before we make the decision about removing your colon. So dinner time comes, and in comes, you're starting to get the picture. I'm at the hospital, a number of years ago. In comes the dinner tray, right? Roast beef. There's some nice music in the hospital room. Roast beef, a pile of mashed potatoes, and some big piece of cake, white flour sugar cake. And I say to the attendant, respectfully, you can take that back. That's not what I'm going to eat. And I pick up the phone and call a friend. And I asked her, would you please come save my life? Would you steam some greens and make some brown rice and bring it to me at the hospital? Which she did, and that's what I ate. And knock on wood, by end of the week, the inflammation had cooled down. I did not need the surgery. And I'm telling you now, I'm healthy as can be with a really healthy gut, not taking any medication. And but what happened is during that week, when I was lying there, I thought about how fortunate I was that I knew what I needed to get myself healthy. I knew what I needed to eat, and I had access to it. And I thought about all the people who don't, who either don't have the knowledge about what they need to keep themselves healthy, or if they have the knowledge, they simply don't have access. So for me, healthy food is personal, but it's not just personal. It affects far too many people and far too many families. And we know that food insecurity, not having the right kind of food or enough food, increases the risk of adverse health outcomes. It complicates the ability to manage illness, and it's linked to higher healthcare costs. So let's look at what food security looks like across the United States, food insecurity. So we know that there are about close to 40 million Americans that don't have enough food, that really don't have enough food to lead an active, healthy life. And that there's a higher rate of food insecurity in households with kids. So we're not doing an especially good job in this country of taking care of our children when it comes to food security. And Michelle, as you were just saying, kids don't eat well, they can't learn well. So we're really affecting a whole generation this way. And here's what it looks like in Michigan. In Michigan, 1 in 7 of us Michiganders are going hungry or classified as food insecure, about 14% of our population. And I'm going to talk a bit about SNAP, Supplemental Nutrition Assistance Program, what used to be called food stamps, but we know, so we have a program, many of you I'm sure know about this, that for those low-income families in this state and across the country, there is available food assistance called SNAP, Supplemental Nutrition Assistance Program, a monthly allocation to purchase food. And we know that over 35% of the households in the state of Michigan that receive SNAP benefits have kids. So again, it's really affecting our children overwhelmingly. It's about 12% of the Michigan population that are receiving SNAP benefits right now. And we know that food insecurity means higher medical care spending. In fact, a strong correlation between food insecurity and chronic health conditions. 45% more cost of medical care when people are food insecure. And food insecurity and poverty, of course, are connected, but what we have learned is that even a stronger connection exists between food insecurity and employment. So it's much higher for folks who aren't working, who don't have jobs. So these are really daunting statistics. So, you know, when I started looking into, like, who has access to food they need and who doesn't, and you start looking at it, it's very, very daunting to see how prevalent this problem is. And it's all around us. It's in every community. But it's really not the whole story. At Fair Food Network, the organization I founded 10 years ago now, we have a mission to harness the power and potential of food to really grow health and wealth in communities. And I want to just start an introduction to what we do at Fair Food Network with a short video, so you can hear it from others in the community who are impacted by this work.
Imagine a world where everyone has what they need. A world where every child sees a bright future, filled with thriving families, vibrant neighborhoods, and an economy stronger than ever because it works for everyone. And imagine it all started with something as simple as good food. It means life. It means health. It's at the heart of our economy. And with the right ingredients and the right support, we can grow more with food than we ever thought possible. At Fair Food Network, we believe in a future where everyone can harness the power of food to transform their communities for good. From farmers to families and beyond. From day one, we've been relentless in our mission to grow community health and wealth through food. With programs that grew from a pilot in Detroit into a model for the nation, doubling the amount of healthy food on the tables of families who need it most, while putting more money in the pockets of local farmers.
Thank you.
Through work that invests in the dreams of good food entrepreneurs, opening more doors for more people in more places. Work that proves that the more we put in, the more we can watch what grows up around us. Watch what grows when a family can put more fresh food on their table. When a family farm can pass down to the next generation. When the dollar you spend goes to your neighbor. And when a dream turns into a reality. We won't stop thinking bold, innovating smart, and investing big until everyone has access to the transformative power of food. Because when you invest in food, you'll be surprised what will grow.
So that's why we do our work at Fair Food Network. But no matter how we each approach our work, whether it's through the lens of public health, economic development, climate change, resilient communities, we need to care about food, because food affects all of those issues, and all of those issues are affected by how we grow, distribute, and eat our food. So there are many challenges and many opportunities in what I call the food system. You know, there are challenges, you heard Dr. Rivard talk about some of them, challenges of chemical runoff, of soaring rates of diet-related illness, of urban sprawl, of corporate concentration, where 80% of all of our livestock products are packed by 4 companies, or 42% of our groceries in this country are sold by only 3 different grocery companies. My belief is that we can't change this system the extent that it needs to be changed simply by focusing on what's on our plates. It's important that each of us pay attention individually to what we're eating and what we're buying. But as I like to say, we're not going to eat our way out of this problem. We're not going to shop our way out of this problem. Alleviating this problem requires us to reimagine this system. Reimagine our food from farm to every fork in ways that deliver good food, food that's healthy, green, fair, and affordable to everybody. And while there's a lot to be done, and it seems daunting and overwhelming, there are great signposts happening right now along the way showing us solutions. Now, many speakers at the conference are talking about this, both here and tomorrow. We are surrounding ourselves with solutions, or what I like to call solutionaries. And the good news is that we can start anywhere. We have a good start at solving these issues. Positive change is afoot in reimagining and reinventing our food system, and there's good news that Michigan is really leading the way in many ways. At Fair Food Network, our mission comes to life through different programs and partnerships that are making healthy food accessible and available, and opportunity possible for many more people in the food system. So I want to start with a description of our signature program that we call Double Up Food Bucks. Double Up Food Bucks, you heard mentioned in the video. Anybody with that participates in SNAP, in the Supplemental Nutrition Assistance Program, can double their buying power if they use their SNAP benefits at a participating location to buy fresh fruits and vegetables. Spend $20 of your food assistance money on fresh fruits and vegetables, you go home with $40 worth. An incentive to use that money in a different way. Now I want to ask a question. When you heard that Michelle tell you that I'm a former professor, so I can never pass by the opportunity to give a little pop quiz. So when you think of food investments, food and agriculture investments that our federal government makes, right? So Congress every 5 years authorizes and puts into place what's called the Farm Bill. I call it the blueprint of our food and agriculture system. It's about $1 trillion bill that they do every 5 years. Where do you think most of that money goes? Corn, large farmers, that's what I'm hearing? Okay, so it's always good to actually look at the facts. That's the Farm Bill budget, right? So there is some money going into what we'd call commodity programs, about what you may call subsidies for corn, about 7%. Almost 80% of what we spend, of our tax money, the public money we spend on our food and agriculture system, goes to SNAP, goes to nutrition. So what I think about is what can happen if even a small portion of that piece of the pie goes to healthier eating and supporting local farmers. That's how you make a difference. And that's what we are doing with Double Up Food Bucks. So let me take you on a bit of a field trip. Our first stop is going to be in Detroit 10 years ago, where we started the Double Up program at 5 Detroit Eastern Market and 4 other small markets, just as a pilot to see how it would work. And basically, it's very simple. You spend $1 or 10 at the farmer's market, you get the equal amount of Double Up Food Bucks, go home with lots of locally grown fruits and vegetables. We call it a win-win-win. Families taking home more healthy food, that very same dollar going to support local farmers, and all those food dollars staying in the local economy, creating jobs and business opportunities in the community. So we've been at it for about 10 years now with Double Up Food Bucks, and I'm going to show you the results, some of the highlights of our results. Because we evaluate this. I'm, after all, a scientist in my background, so I believe in not just doing the work, but seeing what kind of impacts we're having. We know that SNAP recipients shop more often and eat more produce with Double Up. In fact, the number of shoppers that purchase fruit and vegetables more than 6 times a month increased by 70% when they were using Double Up food bucks. We're reaching those most in need. We know that most of the folks we're meeting are the lowest income families on the SNAP program, and they have low or very low food insecurity. So we know it's working for families. We also know it's working for farmers. More than 50% of the farmers that are participating in the program at farmers markets and CSAs and grocery stores throughout the state tell us they're making more money, they're gaining new customers, they're increasing their sales. So we know it's working on that score as well. It's also benefiting beginning farmers the most, which I think is really important in this state. So again, you can hear all this from me, but I also want you to hear it from some of the folks who are having some impact from this program.
Everybody's journey, everybody's situation is different. You can't give up. You got to figure it out. I mean, that's what life's about. You got to figure out how to make things work. You know, I'm a single mother. I'm working 2 jobs, and it's just not enough. And I have to use SNAP to, make it through each month and make sure my kids are fed. Also, trying to eat healthy is expensive.
I was a stay-at-home dad for 7 years, and then eventually I found myself suddenly single, and I needed to find work, and so it's kind of a scary time in my life. I found these jobs that I have now, and at first I applied for SNAP benefits, and that made a huge difference. It was a huge relief to have some assistance every month. Double Up Food Bucks enables me to buy the fruits and vegetables I wouldn't be able to afford without it.
You get more for your money, and it's healthier, knowing that you got Double Up Food Bucks, and hey, you spend $2, you can get $2 more. Hey, I got more fresh vegetables.
The produce section is where I want to go for my kids. I'm able to buy more fruits and vegetables because they're affordable, they're twice as affordable. Eating healthy is very important to me, and especially feeding my kids fresh food. I'd much rather buy local produce, and this makes that possible.
I'm just always focused on my kids, trying to be the best mom. And having the fresh fruits and vegetables to double up what I'm getting is awesome.
So you can hear the story from me, but to me it's much more powerful to hear it from some of the folks that are actually involved in it. Well, we know that Double Up, that these incentives work. People are increasing their consumption of fruits and vegetables, decreasing their prevalence of food insecurity, which means their health outcomes are going to be better. Double Up Food Bucks is now in about 250 locations throughout the state of Michigan, farmers markets, farm stands, and grocery stores. And about 95% of Michigan residents are in a county that has Double Up Food Bucks in at least one location. But we're not stopping there. When my staff asks me sometime, what's our end goal? I say total world domination with Double Up Food Bucks. So we're actually spreading across the country, folks. Double Up has become a model for SNAP incentives across the country. We now have the program going in over 25 states, close to 800 sites. Since 2009, $23 million of sales through Double Up and about 15 million pounds of healthy food. Where otherwise it would not be. Thank you very much, but I especially want Annie Shapiro and Angela Hojnacki from our staff to hear that applause. They're here, And they're doing a workshop tomorrow. If you want to learn more about the details of Double Up Food Bucks, come to that workshop tomorrow, because it's our staff at Fair Food Network that are really making this thrive. And this is how it looks. This is the growth since 2009 of the program. Growth in number of locations and in the sales of produce. But again, I feel it's just a start. We continue to push the field forward. We're focusing on the technology it takes to do these kinds of transactions with Double Up, about how we can communicate with folks about it nationwide. We continue to partner with communities across the country to move this forward. In fact, we have just established the Healthy Food Incentive Impact Hub at Fair Food Network, which is a training and technical assistance hub for the entire nation. And that we will be able to announce very soon a grant from the U.S. Department of Agriculture that's going to be supporting that over the coming 4 years. We have garnered great public support, both here at our home state and nationwide, for Double Up Food Bucks. And I think it's because we're able to speak to many different, we call it a win-win-win, many different aspects to it. We can talk about economic development, we can talk about the health outcomes, we can talk about the importance to farmers, we can talk about poverty alleviation, and it can resonate with different policymakers. But I want to tell you, one of our strongest champions for Double Up Food Bucks is our home state U.S. Senator Debbie Stabenow. In fact, I got to tell you, when Debbie Stabenow was the chair of the Senate Agriculture Committee when the 2014 Farm Bill was being debated, she put a provision in the Farm Bill that brought $100 million of federal money to take Double Up and expand it nationwide. And when the Farm Bill was reauthorized last December, she was instrumental, along with her colleagues, of not only protecting Double Up in the Farm Bill, but increasing it. It's now went from $100 million to $250 million over the next 5 years, which makes it part of permanent law. So that means Double Up is now part of what's going to happen permanently in the Farm Bill. Remember that big slice of the pie I showed you? We're on our way to taking a little slice of that, putting it to healthier eating and supporting local farmers. That's what we're doing. And as a community, we need to shepherd these kinds of public-private partnerships into reality and expand them. We need to identify solutions, build models, provide the evidence, and then scale the models into community practice. And I want to give a real shout out to Groundwork and the work they've done on 10 cents a meal. This is another model like that, a win-win-win solution that started as a model, is now expanding statewide. So I want to tell you, I want to recognize the 10 cents a meal program as one of those solutions that is working. And as far as I'm concerned, Diane, we should think about total world domination with 10 cents a meal. So a common feature to these programs is that you get multiple benefits simultaneously. It's not trying to solve a single problem. You're trying to reinvent a system that can address many issues at the same time. And that's one of the filters we use for all of our programs at Fair Food Network. It's really at the core of another one of our initiatives, which I'll just mention, the Fair Food Fund, which is an impact investing arm of Fair Food Network. My belief is that the food economy in any community is the first economy of that community. Community doesn't exist without the food economy. And we need to find many ways to invest in the success of entrepreneurs in those communities that are providing healthier food for the residents, that are providing jobs in those communities, the same kind of communities where Double Up Food Bucks is happening and where 10 cents a meal is happening. We need to get just hundreds of entrepreneurs working in those communities. That's how we rebuild a better food system. And our approach with the Fair Food Fund is providing customized financing, meeting entrepreneurs where they are to help them grow their businesses with wraparound business assistance. So make sure that those entrepreneurs that have passion for this kind of food and food businesses can match passion with the skills they need to run a profitable business. From a systems perspective, these kinds of interventions can make a difference. You know, what I like to say is, you know, we can make a choice. We can either pay the farmer now or the doctor later. I'd rather pay the farmer now. This is the kind of impact that the Fair Food Fund has had. So again, we measure impact with our work, and we know that, in short, for every $1 that we've invested in these kind of businesses, there's been $9 in community benefits generated. That includes purchases from local farms, includes jobs created, and so forth. And I'd be happy to talk with any of you, you know, in a question and answer session or later about some of the specifics and some of the kinds of businesses we've been supporting here in Michigan and in other places. When we invest in entrepreneurs, it's a powerful way to create change across the food system. So in closing, I want to just say that it's been an honor to be with you here tonight in this way, and I look forward to more conversations. It's been an honor to share my story with you and a little bit about the work at Fair Food Network. As we engage in more conversations in the conference, you might wonder about ways you can become involved in implementing healthy food type of initiatives in your communities. So I want to leave you with 3 takeaways. 1, you are powerful messengers. In fact, those of you that are in healthcare, we have found through research we've done that the most powerful messengers about double up food bucks are doctors and healthcare providers in clinics where low-income people come. So for you to let them know that double up food bucks is there and available, that's something powerful you can do. Secondly, we're never going to be able to eat or shop our way to a better food system. We all have to take personal responsibility, but we also have to get engaged with public policy. We have to get engaged supporting things like 10 cents a meal in Michigan and double up food bucks in Michigan and at the federal level. And third, there are positive models that are happening all around us. I'm just mentioning a few of them, but they are all around us right now. As community leaders, we need to look for more win-win solutions like these and support them in any way we can. Working together, this kind of change is possible. So as the conference continues, I hope you will find inspiration to take back with you. I look forward to our chance to interact later on this evening, and by taking time to connect and learn and have expanded conversations with one another, we have a great opportunity to unite bright minds in conversation and in action to define the future of the connections between food, farms, and health. Thank you very much for your attention.